Welcome to today's edition of Mental Health Matters. Today, we're going to be talking about the benefits of therapy. I have Jamie Jones on the show today, and she's going to talk about her experience as being a therapist. Welcome to our show, Jamie.
Hi, thank you for having me.
Yeah, so I like to thank people who take the time out to just come and share their experience on whatever topic that we're talking about. I know people are busy, and I know you are one that's definitely busy. So, thank you.
Thank
Um,
you.
why don't you just share a little bit about who you are, and then we'll go from there.
Wonderful. My name is Jamie Jones. I am a therapist. I have a couple of different roles. I work as a therapist at a rehab facility during the day for the last few years. And recently, I'm going to venture out and open my own practice. I have been working in the evenings as well, doing my own practice. So it's exciting adventure. Um,
Nice,
Yes, and I got my degree from Sac State. I'm woohoo, NorCal.
nice,
Yes,
nice,
so it's been a long road, but very exciting. Lots of new things coming up.
nice. So I'm curious, how long did you have to get an education to pursue the career that you're pursuing?
So what happened is first I decided I wanted to be a child psychologist when I was back in high school, and I wanted to have my own practice. And but I didn't come from a background where people told you how to get there. I'm
Yeah,
this generation, so I didn't know what that looked like. I just knew I wanted to help people, and so I decided, oh, I'm going to go to college. I'll figure it out. I don't know how to do this. I don't have money.
yeah,
Went to a junior college and got my degree or got my transferables because I knew, okay, I'm going to get my bachelor's in psychology. Nobody ever told me, oh, you need to you need to figure out a specialty.
yes,
And what psychology really entails is a lot of paperwork and medications. And I was like,
yeah,
I don't necessarily want to do that. So
yeah,
when I went to Sac State, I got my bachelor's in psychology. And then I decided I wanted to focus on school. And
nice.
so I got my master's in school counseling. I graduated in 2002.
Okay,
And I was very fortunate. The school I graduated from, I ended up getting a position there after a couple of years of working in different fields. Um,
wow,
I'd been there for like almost 20 years, and I was like,
wow,
I want this, but in the back of my mind, I always wanted to open my own practice.
yeah.
So I
Wow,
was like,
that's a blessing though.
yeah,
So what made you choose this particular career as a therapist?
oh my goodness. Well, I think growing up, just like our life experiences, kind of gives us a calling of where we're going to go and how we're going to be, and if we take on that role. For me, um, I kind of had a really hard upbringing. And
Mm-hmm.
so there was a lot of abuse and a lot of drug abuse. Growing up in that, I knew there was something better out there. I just didn't know what, because I
Yes.
was really exposed to that. But I
Yeah.
knew I didn't want to go down that route.
Mm-hmm. Yeah. So where did you grow up at? I'm just curious.
Lots of different places, but I was born in Eureka, and I was born out of a very unconventional type of thing. My mom was addicted to drugs, and
Okay.
she was a prostitute, and so
Mm-hmm.
I came from that. Um,
Yeah.
and so when she had met the person that she had said was my father, she
Mm-hmm.
um, I was, I guess, like 3 or something. And then he was involved in the law a lot. So we moved a lot. And they all
Yeah.
worked on different, like I said, it's gangs. And he used to guard, like, drug things up in the mountains and stuff like that. So we would go on reservations and go in different types of mountain areas so that he can go work. And then, he'd come and they would both get sober and try to live a better lifestyle. And so we would,
Yeah.
and we moved like probably once every year, if not
Yeah.
more.
Wow. Yeah, I can definitely relate. I was born on the west side of Chicago, so
Mm,
that type of behavior was very prevalent, very dysfunctional family, drugs, guns, murders, you name it. But like you, I wanted a better life for myself, and I too went back and got 3 degrees, and my last degree was a master's degree. So yeah, I can totally relate.
Congratulations, man.
Yeah, yeah.
Awesome.
Yeah, thank you. So is that what brought you? Because I know we talked yesterday. You talked a little bit about just that you have a testimony that got you to this point. Are you all comfortable with sharing a little bit of that? Because now you got me intrigued that you just shared what you just shared with me.
Yeah, I actually am totally fine with that. So
Okay.
I knew that I wanted to help people. And
Yeah.
growing up in the dysfunction that I had, I wasn't exposed to God at all. But what was really strange is I felt like as a kid, I even knew that God was protecting me.
Mm-hmm.
And
Wow.
there was this one point that we lived, it was in Sacramento actually at a point in time, and it was in the Heights. And we lived in this project area, and there was this large, I just remember, white school bus. And
Yeah.
I was probably like 7 or 8 years old. And this bus would come every Sunday morning and pick up kids to go to church. And they knew that area was rough. All of our parents were partiers and stuff. And so, all of us, you bang gay kids come out looking like
Yeah.
Europe and stuff. But I just remember the church being, especially the children's church, being really welcoming, and they never like judged us. And I just remember one lady coming up to me and saying, "Don't worry, God's always watching out for you." And
Wow.
I just was like, okay, whoever this God is, that's cool. But I just felt safe.
Yeah.
And I wanted to help people. And I was in the midst of helping people, especially at Sac State. I felt like something was missing um, to that. Like I wanted to help people, but I felt like I can give more than just therapy. I knew hope, and I knew
Yeah.
that the Lord could heal. I knew that there
Yes.
was this like into it that you just needed to suffer and kind of like live with all of this dysfunction, but that there was healing in the process. And I wanted to give hope. And I have a friend who, she's amazing. Her name is Gina Watkins. Her and her husband have a church. And she would, talk to me. She'd be like, Jamie, what do you want to do? Like, why do you feel so unrested, like unsettled? I'm like, I just don't feel like I'm supposed to be here. Like,
Yeah.
it's like, it's perfect. I have this perfect job,
Yeah.
retirement. And she's like, well, what do you feel like you want to do? What is missing? I go, I love being able to help my students and be there for them. I love that aspect. I love the counseling aspect of it. But I want to be able to give them hope and talk about God or Jesus if they're open to that. That makes me
Nice.
feel good. I want to be able to pray with them if they would like prayer.
Mm-hmm.
In that type of a setting at a state university, you're not allowed to do that.
Yeah.
And so I go, okay, I think I am supposed to open my own practice. Mind you, I got my degree in school counseling. It is in the counseling arena for master's degrees, but
Yeah.
to be able to open your own practice, you have to have a like an MFT in that portion.
Yes. Yeah.
And there's a couple of classes that I was missing. And I didn't even know. I thought I was told that I had to retake a bunch of classes, the same classes. There was only 2 classes missing in my STEM field, like when you go off to your own specialty. I was like,
Yeah.
I don't want to go another how many grand in debt to take the same
Yeah.
classes. So I went and I spoke to one of my mentors at Sac State as a professor, and she's like, "Oh, there's this option. It's called licensed professional clinical counselor. You have the degree for it. You qualify. All you need to do is take these 2 other classes, and that's
Wow.
another class." Okay, I decided to do this 2 weeks before spring semester starts. I'm not even accepted. I work there, but I'm not
Yeah.
accepted.
Yeah.
I'm not a student anymore.
Yeah.
And these are master's level courses. So the regular way to go about this is you're supposed to, about a year before, you're supposed to fill out this application and say you would like to take classes and maybe get granted. And you have to go through all of these supervisors and all of this stuff. And then you have to get approved for the master's program to be in it after the
Yes.
interview is okay. And then after all the students and everybody register for their classes, you have to go to the professors and beg to get in their classes. I am trying to do this 2 weeks before the semester starts. Dude, the Lord is amazing, right? All of a sudden, I am sat in front of all of these people. I go to the chair of the master's program and I'm just like, hey, how do I do this? Is this possible? She's like, yeah, for you, it's possible. I've met
Nice.
this woman one time.
Nice.
She just liked me and she
Nice. Yeah.
the favor, right?
Yeah.
So she's like, but I'm going to say yes, and you can get into the master's program, but you have to ask the professors because all of their classes are full. And there's one particular professor that they say she doesn't like anybody.
Yeah.
I'm like, okay, that's not a problem. And
Yeah.
so I'm getting everything. And mind you, I'm trying to get all the financial too, because Sac State's very, very much by the rule book. They don't like to go outside of the box at all. And so,
Yeah.
I'm going through all those doors and I have a woman who's working really hard and tirelessly. And I end up getting approved a week after classes started. I go to the professors. Ends up that the professor that they're saying is a problem was my mentor, the one who told me to go ahead.
Wow.
So she's like, absolutely. And then this
Wow.
man, he was so nice, Dr. Caesar. Oh my gosh, he was like, yes, absolutely.
Wow.
I get in and I'm not, 2 weeks before that, I wasn't even a student and I got everything paid for. Everything.
Wow.
What was weird is that before this even happened, the Lord kind of spoke to me a little bit and he was like, don't worry. Cause I was like, how am I going to afford all this? Cause it's thousands of dollars after you've graduated. All the doors started opening. And then after all that, I was like, I have to find somebody who's going to supervise me.
Yeah.
Supervision is something that you're supposed to do and you volunteer your time and you have to pay your supervisor. I'm like, once again, Lord, how is this going to happen? Like, I don't really have the funds. Plus, I really want somebody who is Christian based. And mind you, I'm not a Christian based therapist, as in, if you're not a Christian, I can't be your therapist. It's just my own personal faith. And if you share that faith, then that's great. And we pray together and stuff. But I just wanted that supervision. I wanted her to, feed that into me. And, so I ended up going, and I don't even know why, but I went to Capital Christian because I heard that they had a counseling center.
Yeah.
I see this picture of this woman and it says she's the internship supervisor. I call her up, ends up she's opening her own practice and she's quitting there and she's looking for an intern and she wants to interview me. I'm like,
Wow.
okay.
Yeah. Wow.
Ends up, she pays her interns to work for her.
Wow.
I'm like,
Wow.
what? And she's like, yeah, so you don't have to worry. Whatever money you're making, I will take my fee out of, so you don't have to take it out of your own pocket, because I know that students are usually not very, they don't have a whole lot of money.
Yeah.
And she's like, and then and I'll pay you hourly. I'm like, that just doesn't happen. And we
Yeah.
clicked. And the day
Yeah.
I met her, I literally knew I was going to be joining practice with her.
Wow. Wow.
And
Wow.
5 years later, after all of
Yeah.
this, she was like, okay, Jamie, when are you going to get your license? I know your hours are up. And are you wanting to come in? She has an extra office. And I would look at that office and I'm like, that's going to be my office.
Yes, absolutely. Yes.
So yeah, she's
Wow.
the one who I'm going to be starting with.
Wow. That's awesome. That is definitely awesome. So where are you at in the process now? Are you, how long do you have to finish your class? Are you finished? And,
I'm
what's the
finished.
process?
I'm
Okay.
finished with everything. I
Okay.
actually I've been approved to take my exam, but the way
Okay.
that the Board of Behavioral Sciences is, and I think probably with the pandemic, I got approval to schedule my exam. So I'm waiting
Oh,
for them to open up the portal. And as
okay.
soon as they do that, then I'm going to go and take my exam. So,
Wow. Nice. Congrats.
yes.
That is a blessing. That's a
Mhm.
blessing. I'm curious to know, how do you incorporate your Christian faith into the work that you do for your clients? Like,
Well, like I said, you don't need to be a Christian to come and see me, but I
yeah,
feel that being a woman of faith, I pray over my
yes,
sessions, and I allow whatever God would like to do in that person,
yes,
that healing. And one thing that I find that's really quite amazing, because people ask me, how are you able to go home and like deal with people's problems and stuff like that? And if they don't do well, I'm working in addiction, it's high relapse at times. And, if they don't do well, how do you take that on? And I'm like, you know what? First of all, I know this has nothing to do with me. I know that this is God, and
yeah,
God is walking them on their journey. And
yeah,
I'm just here to plant the seeds and
yeah,
open the doors and help them in whatever they
yes,
decide to do, whatever doors they decide to do to walk through. So that's just, it's more of the fact that it's my own walk, and I pray
yeah, yeah,
before my sessions. One
yeah,
thing that I do when I do brain spotting, I
mm,
truly believe that that's a spiritual experience. So I
okay,
always pray before those sessions and just ask the Lord to help them. I pray personally if I know
yeah,
that you're a man of faith, and I'll say,
yeah,
is it okay? Do you mind? Um,
yeah,
and then also just that offer of hope, right? And
yeah,
being able to I don't believe, that everything's going to disappear,
right,
that we need to avoid and just think of everything as always positive, because we just have to. Sometimes I feel like religion will shame people if
yeah,
they admit their struggles, or if they're having struggles, and saying that they're
yeah,
not praying hard enough, or they don't have enough faith.
uh-huh,
That's not where I'm coming from. I
yes,
think that the hope in it is that you don't have to go through it alone,
yeah,
you
yeah,
know, and that eventually, because the Lord gave us all of our emotions, and
mm-hmm,
he gave them to us for a reason, so we need to process those emotions healthy. I mean, in the Bible, Jesus, he got angry, he got frustrated with people, he also got very joyful, he
yeah,
cried, Jesus wept, the shortest. Yeah, I mean,
yeah,
it's
that's the
like, so
shortest
he
verse.
gave us all
Yes,
emotions. But
Yeah.
he showed us how to process them,
Yeah.
not stuff them and be ashamed. Don't be ashamed to cry. Don't be ashamed to
Yeah.
tell people when they've hurt you and put up
Yeah.
your boundaries. He was such a great role model for that.
Yeah.
And so I just try to reinforce that, what, he came down as a human being to show us that he understands where we're coming from and that it's okay to process through this stuff. Don't hold
Mhm.
that in.
Yes, absolutely. You're right. He dealt with a lot of his disciples' internal issues, especially Peter.
Mm-hmm.
And I think that's what hinders people from going to therapy. I think just like mental health, there also is a stigma attached to therapy because it's kind of like all this kind of go together, so to speak. Mental health, you're having issues, problems, you need to talk to somebody, go see a therapist. And I think a lot of times people do internalize their own personal struggles and don't get the help that they need because of a lack of education, a lack of support to try to encourage them to go and get the help that they need. But I think I was telling you, I think we talked about this on the phone, how I feel like more and more people now are starting to get therapy because it's needed. Everybody have problems, everybody have issues. And sometimes you can't talk to your spouse, your mom, your dad, your brother, so sometimes it takes somebody outside of your circle who do not have any biases about your situation to just really bring out what needs to be brought out so that you can get the help that you need. I really believe that.
Absolutely. And this whole idea and label of shame and guilt around
Yeah.
the words mental health, I'm like,
Yeah.
people struggle. We're
Yeah.
human. There is no shame and guilt around that.
Hmm.
And we're not weak. People like to put
Yes.
the word weak,
Yeah.
especially when I was telling you about when I work in the rehab facility. It's men, and
Yeah.
they are vets, first responders, men that are like seen as, oh, I can't
Yeah.
show emotion because it's
Hmm.
weakness. And I'm like,
Hmm.
probably one of the most courageous things you can possibly do is just sit down and cry and say, I need help,
Yeah.
you know?
Yeah. Yes, absolutely. I have a good friend of mine who I met let me see, in I think 2008. And this particular individual is a phenomenal friend of mine. He's a really good person. And when I met him, it was like, in my opinion, he had like no emotions to anything. He was just this, just like a blank canvas to me. And I'm like, very polite, very kind, compassionate, loving, giving, will help you, he would give you the sharpest back. But I felt it was more to him. So as the years went on, I'm thinking like, okay, it was just like our friendship was just surface. So
Mm.
what I would do, I would push the envelope with him and talk about things that I knew would make him uncomfortable because I wanted to bring some type of emotion out of him. Because I'm like, I know you're not perfect. I know you get upset. I know sometimes you probably get sad. And I had to position him because it's a really good friend of mine. It's what I really love and care about. And I really had to position this person to dig a little deep to find a little bit more out about him. And I started to, and so he started to open up a little more and stuff like that. But through the years, I often, he don't know this, but I often prayed, I'm like, Lord, you forgive me a heart for this individual.
Yes.
I would pray for him, his family and stuff. And, so finally he kind of opened up and I learned a little bit more about, I'm like, okay, this is what I want to see, because I think it's important when you're friends, or even with family members, like you said, we have to let those emotions out. We have to, like I've never saw him mad. I'm like, what makes you mad? Like, do you get upset? you know, and but I don't know. I've just never experienced anything like that before. But yeah, I think once again we have to position ourselves to be able to help people in ways that God has blessed us to be able to do that in so many words. So
Absolutely. And I think that way that you were like that friend that said, I'm not going to sit back and just let you be superficial with me, because you mean more to me
Exactly.
than that. And you challenged him, which
Yes.
I'm sure really helped him say he wants to know, you know.
Yeah. Oh yeah.
I
Yeah.
think, I don't know, but I feel like, especially now in the world of social media and
Hmm.
just being connected online, and it's being connected, right? But it's not, because it's very
Yeah.
superficial. It's
Yeah.
like, it's hard because some people are want to share, they don't know how to share, and some don't even know if people really want to know. They'll think
Exactly.
like, no, they're asking me how I'm doing, but they don't really want to know how I'm
Yeah.
doing. And
Yeah.
it's like, when you're that vessel that says, no, I do want to know and I can handle it, and I'm going to love
Yeah.
you no matter
Yeah.
what, because we're human,
Right.
let's get
Exactly.
real.
Mhm. And it's funny because I found myself sort of being superficial, for lack of better terms. And but I didn't want to be like that. I didn't want to have a type of friendship with them, because all my other friends, my cousin, all that, they like, they know me. They know my strengths, they know my weaknesses. They know me, And he didn't know me in that way. And I wanted him to know me. I wanted him to, know me, because he wasn't exposed to who he was. I was kind of like, put up my wall. And I'm like, no, this is like, because I'm like, I know this is a good person. I know we can be good friends. So I have to do something to break that down. And so one of the things I started doing, I started to expose more of myself, more of
Mhm.
myself. I'm not perfect. Now he's a Christian, I'm a Christian. And I think that probably was more challenging because of our faith. So
Yeah.
as time went on, he started seeing more of me. And I wanted him to know my weakness. I wanted him to know I'm a human. I wanted to have conversations, not just so about God, because we pray together and things like that, but other things as well, life things. But it took a while. Believe me, it took a while. But slowly but surely, we both kind of started letting that wall down, which is really good. That was one of the things I really am thankful for, because you don't want to be, have people that you're friends with or family members and stuff, and you just kind of like, no, we're all human. Let's pray for each other, and let's just move on.
I was saying, I love that you brought that up, because one of the things I find, especially with my Christian clients, is that they'll come in and they're very much so, they seek me out, right? So they need
Yeah,
help, and they know they need help. And then they come in and say, no, everything's great. The Lord is fixing everything. I'm praying. It's going to be okay. I'm just not, maybe I'm not praying enough, or all this kind of stuff. And it's like, and I look at them and I'm like, okay, I see where this is going. They feel
yeah,
that they're not holy enough. And I share with them, a little bit, because as a therapist, we've got to walk that fine line of
yes,
what's
hmm,
appropriate. But if it's clinically appropriate for
yeah,
them to know that, you know what, I'm broken too,
yes,
I'm a
absolutely,
sinner too.
hmm,
And you don't need to sit here and worry or try to
yeah,
sugarcoat this for us to get the real healing, because the Lord already knows. Like,
right,
let's just put it out there.
yeah, exactly,
You're just the one that needs to like say it,
yeah,
right?
right,
So I like will share a little bit, like sometimes, like, yeah, I used to struggle with thinking that if I was feeling depressed, and I suffer
yes,
from depression, I had postpartum depression,
hmm,
I was told by my congregation, well, you just need to pray enough,
yeah,
you're just not praying. And I'm like, and then I go to find out, I'm like, well, my hormones are completely off balance, and I'm
yeah,
like losing it, and I'm feeling shame and guilt, because I'm like, why am I not praying enough? I think I'm praying
yeah,
enough. God, what else do I need to do? And
yeah,
so when I sit there and I tell them, this is a struggle, and it has nothing to do with you not praying enough. You know that the Lord gave his life for you, and you didn't have to do anything. And there's
yeah,
nothing that we would work for. There's
yeah,
nothing we could do for that, because it was a gift, and he loved
yes,
you enough. I have to remind them, this isn't about works, friend, because we
yeah,
drive ourselves crazy. And once we kind of get through that superficial level and they start realizing, okay, this is a safe place and
Yeah.
it's okay to be broken, then
Hmm.
we start being able to kind of get in that work, and the Lord is just like able to kind of like, okay, let's get to the roots of this inadequacy, insecurities, worthlessness, helplessness, depression, anxiety. Let's get that crap up,
Exactly.
you know. So
Yes, absolutely. So, in your opinion, what are the benefits of going to seek counseling from a therapist? What in your opinion, what are the benefits?
well, you had mentioned one, which was having somebody who doesn't know you, who is
Yeah.
impartial, right?
Hmm.
Somebody who can't judge you. Or, I
Yeah.
mean, I guess they could, because anybody can do anything, but you're
Yeah.
going in and you're seeking help and you're looking for an outside perspective, somebody who's completely disconnected. Because
Hmm.
sometimes when you're struggling and you go to your family or your best friends, they have all these perceptions about you and all of
Hmm.
these thoughts and all their opinions on the situation. And even though they mean well, it,
Hmm.
it sometimes isn't the best.
Yes.
And it's a safe place too, because we are bound to confidentiality, um, to where you can really share what is
Mhm.
going on and
Yeah.
not have to worry about, Aunt Betty telling your business at the family reunion, or
Yeah.
whatever, it's safe. I mean, other than, of course, I am legally bound by if I find that you are wanting to hurt yourself or others,
Yeah.
or like if there's child abuse or elder abuse, I do have to uh, report. But I mean, that's
Yeah.
it's not like you coming in and saying, oh, I just feel like killing myself today. I'm having a horrible day. That's different than somebody coming in and saying, when I leave here, I have a gun and I'm going to do it.
Yeah.
And because usually people, so that's different things, but the confidentiality and just feeling that impartialness I've noticed. And I'm kind of I'm really kind of a straightforward type of therapist. Um,
Good. Good.
I don't sugarcoat things too much,
Hmm.
which tends to work for a lot of people. Some people find it a little bit too much, which is fine. Sometimes therapists won't work for you, but
Yeah.
I'm a realist. So
Yeah.
with love and kindness and with definitely wanting to help, but it's kind of good too when you have that person with that impartial to kind of get an idea of what's going on, to be able to say, okay, I see kind of what's going on here. Maybe is there a way we could have looked at it this way, or could you work on this, and point out things that other people may not
Yeah.
necessarily say or even feel
Yeah.
comfortable saying, because they're afraid that they're going to hurt you or lose their relationship with you.
Yeah. Yeah. Okay, that's awesome. No, so normally, how long are your sessions? Like, how long is just a general sessions?
An hour.
Um, an hour, okay.
Mm-hmm.
And depending on how much is needed, how much of your service is needed, you
Mm-hmm.
base that off how much they normally come and see you.
Yes. And
Okay.
that's a discussion with the client as well. Um,
Okay.
I will talk to them, especially if something's really going on. I give my recommendations, and I'm
Yeah.
like, if you've got something dire going on, you just lost somebody, or we're going through a divorce, or things are happening, I'm like, we need to see you weekly. My guys who are just getting out of rehab and they want to continue with me, I'm like, I need to see you weekly, because this is a prime time,
Yeah.
just any type of trauma that had occurred. Some people, I just like to see them weekly, and they like to see me weekly, because we need to develop a relationship.
Yeah.
We need to build trust.
Exactly.
And then
Exactly.
as they're going, um, we'll go, okay, let's do bi-weekly, and then as they graduate, it's like, oh man, you're doing well. Let's do like monthly check-ins or every couple month check-ins, just for some maintenance. And, you can come back if you need to, but I don't like to keep people coming to see me all the time, because
Yeah.
I feel like, what do what, if you're doing the work, then we should be getting better. But
Correct.
just depending on the gravity and stuff, because we do have people that have a lot going on and they had trauma that they haven't dealt with for
Yeah.
years. And I mean, if you've got like all this stuff and you're 42 years old and you're just coming in, I mean, we can't just magically fix that after 6 months.
Yeah.
There's no time frame. It's all different for everybody.
Yeah. What do you find, in your field, what do you find has been um, the most significant trauma in individual lives that you have been seeing so far, whether it's abuse, drugs, family got a divorce. I'm just curious to know what is you would say the number one trauma has been that you have dealt with in terms of clients.
Mm. That is a really good question. Um, Trauma is an interesting being. When we look at trauma and like, just in a person, and when I ask them, what is trauma to you? They'll
Mhm.
say, oh, it's like you went to war,
Yeah,
or you were you were severely abused as a child, or physically abused or sexually abused. They
yeah,
don't even put in there the psychological, the verbal.
yeah.
But trauma is different for everybody. Our
Hmm.
body interprets different events, and it will hold those emotions and store them. And we, as a child or adult, whatever,
Yeah,
if it affects us in a way, we'll interpret that, and then it'll cause some sort of something in us that is a reaction like trauma.
yeah,
Like when you got, for example, if you're in a car accident and you get bumped from behind, and then you might notice that as you're driving, you start to get scared because if
yeah,
somebody's coming up too fast on you, you have been traumatized, even though it was just a little bump and nobody was hurt. And
yeah.
people are like,
Wow.
why are you traumatized from that? Well, it put fright in me, and it caused my stress hormones to react, and I reacted to it in a traumatic kind of way, and my brain stored it that way. So
Wow.
I think that people's different traumas, and whatever they may be, I mean, bullying,
Mhm.
verbal abuse, the trauma of just not feeling like their parents, and this is a thing too. A lot of my people come and they're like, my parents did the best they could. They weren't intentionally, they didn't do anything to hurt me. I'm like, no,
Yeah.
they didn't, and they did the best they could. But as a child, when, like, let's say for example, they're trying to give you the tough love type of treatment, they're saying,
Hmm.
just get yourself up, stop crying,
Yeah.
suck it up, boy, and go outside and feel, go beat up the neighbor, don't let him hit you like that, but you're being
Yeah.
bullied,
Yeah.
and then you take that as, now I'm not good enough and I'm
Hmm.
weak and I got to suck it up, and I need to go out there and show my worth by beating somebody down. And that can
Yeah.
be internalized as trauma.
Yes.
So, and then it turns into all this stuff, because what happens with these emotions, right? If we don't process them, they stay inside, they don't go
Hmm.
anywhere.
Yes.
And then it comes out in depression and
Hmm.
anxiety and panic and hopelessness, helplessness, all of the stuff that we feel, just feelings of worthlessness, not being good enough. And they're like,
Yeah.
I hear people, I don't know why. My parents, totally, they made sure I joined every sports team. I did everything that I could, want to do. And I'm like, well, were you ever allowed to fail?
Wow. Yes.
And if you
Wow.
were allowed to fail, how was that interpreted? I mean,
Hmm.
we've even traumatized our kids because we don't have balance in their lives. Like the
Hmm.
generation before mine, it was, put yourself get yourself up off your bootstraps, no crying, like lots of
Yeah.
hitting, abuse. And then my generation were like, oh no, we don't want to do
Yeah.
this anymore. And then we
Yeah.
coddled them and gave like trophies to everybody. And then we never allowed our children to have natural failure,
Yes.
and they don't know how to deal with that. And then they feel like
Absolutely.
a loser, and they feel like they're worthless.
Yes.
And it's just like so a lot of that kind of stuff. And then the fact of just media in general, our
Mm-hmm.
children and what we see. I mean, bystander trauma happens to a lot of us. I mean, we saw that with 9/11, right? Us having,
Yes.
and now Black Lives Matter,
Yes.
this movement that's going on, us seeing George Floyd and the choking over and over
Yes.
and over again, that trauma, and
Yes.
children seeing that. And it's like,
Yes.
yes, this is real. We need to pay attention to these situations, and we need to take action, but we also need to be careful about what we're allowing our little ones to see.
Mm-hmm.
They're interpreting
Absolutely.
that, and then they're looking at themselves and they're like, you may be a brown little boy going, oh
Yeah.
no, what's going to happen to me when I
Yeah.
go out there? And these poor children are growing up in fear.
Yes. Absolutely.
And so I think that that's what we're dealing with, is a lot of people trying to get voices heard and not
Yeah.
realizing that we need to also talk and help and watch what our kids are watching, and be
Mm-hmm.
there for them when they have questions, and not think that they don't understand, because our children understand everything.
Mm-hmm. Absolutely. It's oh man, this is a really good conversation for me. As I was listening to you and I was asking you about the trauma that you've dealt with, dealing, with the clients and stuff, I started thinking about my own childhood, and I come from a very dysfunctional family. But one of the things that my mom did to her kids was she attempted to make us be all close. And what she said was, you don't have no friends. If something happened to me, you guys got to stick together. I'm all you got. And what she was trying to tell us was, you got to stick close as a family. So what happened was, when we grew up thinking that, oh, we don't have no friends. Like, nobody can be close to us other than our siblings,
Mm-hmm.
and it really, really, really hindered all of us, because with me, my mom, when I graduated from grade school, nobody was there. I graduated from high school, nobody was there. And it it was a psychological, it was very impactful for me in a very negative way, because here you is, you're telling me this, but then you're not there for me. One of my older sisters got married, and we did not know how to accept her husband, because now there's somebody that's going to be close to her outside of the siblings. When my
Mm-hmm.
sister started having kids, we didn't know how to accept her kids, because we were taught that nobody should be close to us but the six of us. And that was, it was just crazy. And so one of my I have a sister so I got two older sisters. So the eldest sister got married, and a sister under her, I think she had the hardest, because they were the only two girls.
Mm-hmm.
And she loved all of us, but she loved her older sister. And she did not know how to, my sister did not know how to accept our lives going a different direction. I left, I went to school. My other sister, she ended up, leaving. She got on drugs, whatever, but she ended up leaving and married, like, and it was kind of like she was stuck in a sense.
Oh,
And I see that in families today. I think parents are raising their kids the best way they know how, but when you put this expectation, because even I have a friend that I'm close with, and if there's no, like, he has sisters that will say, nobody, family is all you got, and blah blah blah. And I tell him, he doesn't agree with that. I tell him, I say, I understand what they're saying, but the way it comes off is, if you don't have us, you don't have nobody, which is not true, because
yes,
he have me, and I know I'm there 100%. So yeah, and you just reminded me of that.
absolutely. And you bring up a attachment, right?
Yeah.
You were telling me a little bit, and I don't know your story,
Yeah.
and this is the first time I'm hearing about a little bit about your childhood, and it sounds like already the attachments were very inconsistent. And so as a
Yes.
child, when we're growing up,
Hmm.
especially when we're infant,
Yeah.
toddler, grade school, where our parents are our main providers, our main
Yes.
supporters, and they're supposed to be also the people we can trust.
Hmm.
And when they continually do not show up in the way that is safe, we tend to have dysfunctional attachments. And
Yes.
it could be either where we're very, very scared and we're like very
Hmm.
insecure. And so we push it
Yes.
away, or we grab onto them and we get scared for them to leave. And it's that child that's holding on to the parent's leg going, don't leave me, because they don't know if they're going to come back.
Hmm.
And then you bring on another layer of your mother saying, oh, not only that, not only do you get to like not know if you're going to trust the family or not, but nobody else
Yeah.
is going to be there for you. And so
Yes.
you're like, oh my gosh, okay. And so not even being able to have the ability to know how to have healthy attachments, and then
Yes.
knowing, okay, after you guys drop me, when people leave, they leave me, and
Yes.
I don't get to fill that in with anybody else, and we're
Yes.
not safe. And
Yes.
so for you to like say to me that you're the main person that's like, hey,
Yeah.
no, we're not going
Yeah.
to do that anymore. You're also coming on in a spiritual level, and you're breaking generational curses. And you're
Yes.
saying, this
Absolutely.
isn't going to happen anymore. We're not
Yeah.
going to be alone and isolated, because God made us where we need
Mhm.
fellowship. We need each other.
Yes.
And
Yes.
so, I mean, look at who he surrounded himself with. I mean, he had his mother and his brother, but his disciples, they were all his chosen family.
Yeah.
And so
Exactly.
for you to be able to just like break those generational cycles and say,
Mhm.
listen,
Yeah.
family, I love you, and
Yes.
let's trust, but let's also open it up a little bit,
Yeah. Exactly. Exactly. And it's interesting because my circle, I didn't grow up in a Christian home. I didn't grow up a Christian. It was very dysfunctional. And so the friends I had and the girls I had, I was very attached to them,
Hmm.
but at the same time, I didn't allow them to get too close to me because I
Okay.
was afraid of getting hurt. I joined a fraternity, because I wanted a family, but it was, we was close, but you can only get so far,
Mhm.
and a lot of it had to do with because the way I was brought up, because I was constantly getting hurt, didn't trust people, it was, so then when God started sending people in my life that I can actually trust and that had the Holy Spirit and that I can depend on, he had to teach me how to allow him to love people through me because I was getting in the way. Even though he was using me to disciple people and pray for them and, having a men's Bible study in my home, I still was involved with the worldly type of love. It was conditional,
Yeah.
because I still had I had an attachment, but then I had guards up. And so he allowed me to allow somebody to come in my life, which is a friend who was totally like, this is not but the God, trust me, who was totally like the disciple, well, how the Bible describes us as how we should be towards each other. Love your neighbor as yourself. There's no greater love than this, that a man will lay his life down for his brother. So he put that love
Oh,
in this individual because he knew all the brokenness I came from, all the girls I was with. He knew all of that. So he knew that there was only going to be so far that I was going to let this individual go. And when I met this person, I didn't mean nothing. I've talked to you about God, but you ain't getting close. And this person, as I look back on it, it was the Holy Spirit because everything that I needed, God put in this person. I mean, everything. There was an attachment there, but at the same time, there was a distrust, and so something happened where I had to choose. God started telling me that now it's your time to lay your life down for Him the way that I laid my life down for you through him. And and I had God, pretty much God was challenging me like, you need to make yourself vulnerable. He need to see you in your vulnerable state, because you got this wall up, you got this image up, and you're hurting, you're insecure, you're fearful, you're broken, you're dealing with all this stuff, and you're being superficial with him, when he has in fact made himself 100% vulnerable to you, to show you who he is because of me.
Wow.
And God, he had challenged me, and that's exactly how I got delivered. That's 100% I got delivered.
Look
Yep.
at God, man.
Yeah.
Look at how special and intentional. First of all,
Yeah.
if that person did not follow God's will and do what he
Yeah.
needed to do to be a
Yeah.
part of your life and do what the
Yes.
Lord said to do. I mean, we
Yeah.
never know how much we affect others. We just have
Yes.
to listen.
Absolutely.
When those
Yeah.
doors open, it's like when I was telling you about this, I mean, getting into this journey, right, that I'm in, it's like when the doors open, the Lord's just asking you to walk through. Like,
Yes.
what's the worst thing that can happen? Just
Yes.
walk through. It's
Yes.
amazing how, and
Yeah.
then you were able to see the love of God come down
Hmm.
through a friend and be
Yeah.
like, I got you. And you're
Yeah.
like, and that was so much healing for you, exactly what you needed. And
That's
if you
what.
just wanted to keep up that wall, then
Yeah.
you would have lost that blessing,
Yeah.
you know?
1,000%. And this person comes from a very close family, very,
Wow.
very close family. And because of the dynamics of my family, the way his family was, it was like, well, no, because you don't have no friends outside of us, like, all you got your family. That was his background, which was different from my background. And so when he, quote unquote, was not being, it's kind of like, not that he turned his back on them, but it's like, okay, yeah, Jay is my friend. Yeah, I got Spidey out besides you guys. We're like brothers. So when he was able to do that, that right there was the process that God started to use to break me down, because I'm thinking like, wow, okay, you got they close. And I knew it was the Holy Spirit leading him to do that. I trust me 100%. And it was very hard. I mean, I was very prideful, very prideful, very
Wow.
fearful, very insecure. But I knew God was dealing with me to let me know, you have to do this for your sake, not his sake. And that friendship is what God used to break all those strongholds down, all of them. When I say all of them, because that's how I grew up. I had to protect myself.
Yeah.
I had to protect my feeling. I had to do this. When God was like, no, I am to buy you out of branches. Apart from me, you can do nothing. There's nothing you can do for yourself. So yeah.
Oh, that's a beautiful story.
Yeah, yeah.
Wow.
So we've run out of time for this particular segment. Thank you for watching this edition of Mental Health Matters. If you like this particular show, if you would like a DVD copy of this show, or if you would like to be a guest on our show, please dial 916-366-4600. Thank you.